Understanding the orientation and margins of the Whipple specimen requires a thorough knowledge of the anatomy of the pancreas and its surrounding organs. Note how the uncinate process hooks behind the superior mesenteric vein and artery. The vascular groove created by the indentation of the vein will provide an important landmark in the lab. Distinguish the duodenum's shorter proximal end from its longer distal end. If the stomach is present, the pyloric sphincter can also help identify the proximal end of the bowel. Use the gallbladder to identify the cystic duct, which drains into the common bile duct. There are three major landmarks to be aware of when examining the pancreas. Likening its anatomy to a right hand can be helpful when visualizing this complicated area. The head of the pancreas corresponds to the palm of the hand and is partially encompassed by the duodenal C-loop. The vascular groove, an impression left by the superior mesenteric vein, is smooth and corresponds to the recess between the thumb and index finger. The uncinate process corresponds to the tip of the thumb and typically appears tattered and cauterized compared to the more lobular head of the pancreas. Once the specimen is oriented, measure the dimensions of the major organs and ink the uncinate process of the pancreas. Now, sample the key margins. Submit a shaved section of the proximal bile duct margin, the pancreatic neck margin, and the proximal and distal duodenal margins. Take a perpendicular section of the uncinate margin, including the vascular groove. After the margins have been taken, the specimen can be dissected. Open the duodenum longitudinally along its surface farthest from the pancreas. At this point, the pancreas may be bread-loafed. However, we will proceed to bisect the specimen along its duct systems instead. Advance a probe into the pancreatic duct, out through the ampulla of Vater, and into the duodenum. Advance another probe through the bile duct beginning at its proximal end and continue on through the ampulla of Vater. Carefully take a large knife and bisect the pancreas along the plane you have created with the two probes, taking care to maintain a 45-degree angle between the knife and the probes while making the cut. It is best for one person to hold the probes while another makes the cut so that the blade never loses contact with the probes. If the cut is made successfully, the two ducts will have been bisected, the pancreas will have been filleted open, and the duodenum will have been cut in half. Next, look carefully for any tumors. Examine the bile duct. It is often strictured at the tumor site. Note any masses, ulcers, or areas of puckering along the duodenal mucosa. Survey the pancreatic parenchyma. The gland's lobular structure is usually disrupted by tumors. Once the epicenter is identified, note the tumor's exact location and its probable site of origin. Measure its dimensions in centimeters. Describe its gross features, including whether or not it is cystic or solid. At this point, you may choose to fix the specimen overnight in formalin. Once it is fixed, paint the mucosa of the bile duct with orange ink. This will help identify the duct in later histological sections. To submit sections for histology, take 1 section per centimeter of the pancreas's length, a section of the common bile duct, the duodenum, the ampulla of Vater, and from the tumor. Be sure to include a section parallel to the long axis of the bile duct that encompasses the ampulla, the pancreas, and a little bit of the duodenum. Include sections of the tumor that describe its relationship to each of the organs previously mentioned, as well as sections that demonstrate its relationship with the soft tissue margins. Submit a section from each lymph node. A dissection of the Whipple specimen will be successful if the pathologist is able to orient the specimen correctly, possesses a firm understanding of the anatomy, and is assiduous in sectioning the margins. This will ensure the effectiveness of the surgery and the patient's prognosis.